The brain is beautiful.
So this is Callie, vibrant teenager. At the age of 19, she was an athlete and was the captain of the soccer and high school lacrosse team. She's also a musician. She played the violin, the guitar, the piano, and the ukulele. Unfortunately, on August 7th at about 9:30 p.m. on her way home from work, she had a flat tire pulled over the side of the road. And that evening, her life changed dramatically, forever. She was hit by an intoxicated driver, and she was thrown clear across the highway into the woods. It took rescuers and searchers 20 minutes to find her, to give her medical attention. She spent about 8 days in a coma, and her traumatic brain injury robbed her of a lot of her movement, including her ability to walk. Next, we have Zoe. Zoe, having seen brain injury survivors in the clinic, was inspired to be a physical therapist for brain survivors, for neuro rehab patients. She's quite the overachiever. She was the class president of her school of physical therapy, and she is a member on the Joint Task Force for Traumatic Brain Injury at Vanderbilt Hospital. In 2021, Zoe was diagnosed with a class 2 brain tumor, and she had to quickly have surgery to remove that brain tumor, to resect that brain tumor. But unfortunately, the surgery, having removed the brain tumor, also took away a lot of her movement on her dominant side. So really taking away her ability to treat brain injury survivors that she really built her life around, trained to do. The brain is an incredible organ. It doesn't regrow like muscles or bones do, but it can form new connections, it can create new connections and rewire around those injured and portions that have died in an accident. We call that neuroplasticity, we call that rewiring. But there's a cost to that, right? It doesn't come for free. Neuroscientists in clinical studies have found that it takes about 400 repetitions you have to practice in order to create that neuroplasticity. Now each of us have experienced that, right? From those killer dance moves that we saw earlier, to playing a guitar or that perfect golf swing. You know, the key to a new skill is practice, those repetitions. Well, unfortunately, in our healthcare system, we are vastly underdosing the repetitions that these brain injury survivors really need to retrain their brain. So we talked about that 400 number earlier, that 400 repetitions for neuroplasticity. A large clinical study that came out of WashU in St. Louis found that on average, in outpatient rehab, we're giving our brain injury survivors something like 40 repetitions per session. So 400 to 40, that's a magnitude less than the science says that they need. So about almost a decade ago, Dr. Nick, who's here in the audience, I'm looking for him, there he is. Dr. Nick and I, we were involved with some clinical trials, and our goal was to take this exoskeleton that was in a hospital and miniaturize it and see if we could put it into the home. The key to treatment wasn't in the hospital. There's only so much limited time patients could get at the hospital in our healthcare system. But if we can empower them to do their rehab at home, they can really make tremendous gains. So we've done a lot of work. What we did was we took this exoskeleton, we put a screen with it, there's a computer with it, and on it there's a pneumatic air muscle. So it's capable of moving the individual. We have one for the hand, that's a sleeve, and one for the foot. And really what it's been able to do in clinical trials that we did at the Cleveland Clinic is we were able to show that hour for hour doing rehab with this robot, with the Motus hand, was just as effective as working one-on-one with a clinician. That's hour for hour, right? That was the key to unlocking the next step, which was, well, now if we can get the same hour, well, how much rehab can we really do at home? So we put these devices into the home. Both Callie and Zoe, our users, they are now able to get the hundreds of repetitions every day that they need. One of our users, James Brown, he over the course of 2 weeks, he averaged about 2,000 repetitions a day, 30,000 repetitions in 2 weeks. And that's a dramatic comparison from getting 40 repetitions for outpatient rehab. And when you give the brain, when we can empower the brain injury survivors, the stroke survivors, to get the care that they need, the results are really incredible. So Callie here, she's done 19 months of rehab prior to this already. She's still in a wheelchair, has a lot of difficulty walking. This is about 2.5, 3 months in. She's starting to do some walking with a walker, and she's continuing to do her rehab. And now about 3 to 4 months, she's walking with just some assistance from her brother here. And this is her dancing with her mom at a wedding, really kind of starting to get back to those activities of life that really make life special. We have Zoe here. This is before she started with the Motus hand on the left. She's really struggling to pick up this cup here with her right side. You can see she's helping with her other hand to kind of get that hand around the cup to pick it up. And this is before she started with the Motus hand. And she's really worked hard getting those repetitions in. She's a therapist. She knows how important those repetitions are. And on the right here, we have her after 30 days. We're going to watch her pick up the same cup here. And the difference is just incredible. We can see it, get a thumbs up from her. She's still struggling with that thumb. But, I mean, this is what happens when we get the proper care to our brain injury survivors. Our medical system is broken. I don't need to tell anyone that, but we know that if we can just enable the tools for our brain injury survivors, they'll do the work and we'll see the gains. So at Motus Nova, our mission is to make rehab accessible to everyone and anyone, regardless of where they live, their income, their location, their background. And we are in about 2,000 homes across the US today. And really our users are our inspirations. We really see ourselves as a tool, as a bridge to enable the stroke survivors, the brain injury survivors to get their rehab in and really show us what they can achieve. Thank you very much. The Sabo, for everyone, it's a glove that you put on. There's springs on it. And it tries to open your hand. A lot of stroke survivors have this flexion synergy where they close their fist. So Sabo is a passive device. It's constantly giving the same amount of push to open your hand. It's like, learning to swim with a life jacket. If you can bear with me with this analogy. We learn to swim. Some of us have learned to swim. And it takes time to practice that skill, just like any neuro rehab. The life jacket, in this case, it's like a passive device. It will keep you floating, right? You can swim with the life jacket, but it's constantly giving you full assistance. Like the Sabo, it's constantly going to give you a constant assistance. The key is, a good coach will do this for you, or a good rehab therapist. The key is to reduce that assistance over time, depending on what you need. Because we have to force the user, the stroke survivor, in this case, to move as much as you can, because that's what your brain needs for the repetition. If you know that your hand's gonna get open, you can just relax and let the Sabo do the work for you. But our device, that robotic device, we've got sensors on board. We make sure that you're doing the work. We're not gonna do it for you. And that's the key, right? As a good, going back to learning to swim, a good coach is going to hold you up in the water less and less over time. Not like that life jacket that's just gonna push you all the way up. And they're going to let you fall a little bit. You're going to have to swim on your own. And as you start to learn, as you start to practice, that's when we make those neuro connections. So that's the difference. It's a passive assisted device, which means all up the same amount no matter what all the time, versus an active assisted device, which is what we have. We have sensors. There's a muscle that actuates, that moves you, and only moves you to the degree that you need to complete your movements. Hopefully that answers your question. So we help folks with MS, so let me be clear. We've done clinical trials It's a multi-site randomized controlled trial with the Cleveland Clinic, Emory University. It's 100 folks in that trial, and that was just stroke survivors. So we are clinically indicated, we're an FDA Class 1 device for stroke. Now we have a lot of off-label use. We have TBI survivors, we have MS, we have Parkinson's. For off-label use, it's basically, it's like we talked about, it's like rehab. If you're doing rehab, if you're doing physical therapy, that's something that we can help with. And for most folks, making those movements, that's what kind of helps re-engage. Or in cases of degenerative diseases, it slows down kind of the symptoms and gives more movement. Our goal is to give more function to the folks that have injuries. And tone and spasticity is very, very much things that we help with. And please, I encourage you to talk to Dr. Nick. He's a neuroscientist, also a doctor in physical therapy, really knows this stuff, and he'll be able to answer some, get into the weeds. He likes to do that. You have to watch out for him. You have to stop him sometimes. As with a lot of new technology and innovation in medicine, insurance does not pay. And it's something that I hate saying, and especially to someone that I'm talking to that's maybe a stroke survivor, TBI survivor, and I have to say that. We are, that's been our mission, to reduce the price of the cost of the device. It was a $20,000 robot in the hospital. That was way too much. Now we do a subscription model. It's about $100 a week. It's still a lot. We are looking to continue to reduce the cost, and our goal is about $10 a week. And we're doing this just completely without insurance coverage because it takes something on the order of 5 to 10 years to go get that reimbursement. We're going through that process, but we're not waiting at the same time. We're trying to find ways to get this into folks' hands. And we have grants and things like that. So we have some options for some folks that have financial difficulties. But yeah, at the end of the day, we're trying to get this into as many homes as we can. Something like we're looking at, if we hit about 10,000 folks across the US, then we have a very strong case to force insurance to start covering some of this. So we're really working towards that, and we really hope that anything you can do to support us in our mission as an OT, we would really appreciate. For every one of us on our team, we have some connection to a brain injury. You'll have to ask Nick about his, afterwards. But it's really the survivors, the achievements, the users. They really drive us and motivate us to do our work. So thank you for that. It's really a two-way street. We thrive off of the gains and recoveries that our users make, and that really pushes us to try to move the technology forward. Thank you.